I am glad that we have received this consignment because this hospital has had no drugs for quite a while, and a lot of residents of Embu County would come here and not get the necessary treatment. And we want to make this not just a one-off thing, but the normal and natural thing that must continue going on into the future. We do not need to have such functions to receive medicine or non-pharmaceutical products, or even to receive all other supplies needed in this hospital. We just need to see them coming, and we need to see people leaving the gates of this hospital healed and healthy to go and lead a productive life. That is why we are here this morning. But as we do so, we must change the systems of how we've been managing supplies in this hospital. We must ensure that the medications we get, the non-pharmaceutical supplies we get, whether they are gloves or bandages or cotton or whatever consumable that we have, is used for the purpose it's supposed to be used, and used within the facility of Embu level 5 and not outside. We must change our systems, and I'm happy we are working towards making level 5 an independent institution that can run on its own and have powers to use whatever revenue that is collected, plow it back to the hospital so that we can improve on the services. So going forward, we will be seeking the support of our MCAs once they have been sworn in, to allow for us to pass a bill that will make level 5 hospital a truly independent institution that will be run as a semi-autonomous institution of the government of Embu County, so that they can be able to manage their own accounts, their own revenue, and plow it back and depend on what it is they are able to collect. This hospital has a capacity of collecting anything between half a billion to 600 to 700 million a year. And we believe it is doable. So we are going to improve the services, make sure every department is working optimally, make sure the laboratory is working well. We still have some reagents that we have not been able to procure. They were not available at Kemsa, but we'll make sure we get them elsewhere. We're in the process of procuring them from elsewhere. We still have a few consumables that are required in the radiology department. We'll make that possible so that going forward, no patient has to go out and pay more money if they can't afford it. They will do it right here at a cheaper cost.
We made a commitment that within 100 days, there are two areas we must fix. The issue of health and having enough drugs in the facilities. Number two, we say that we must clean our town and all the markets in Embu County. I think we are very much on course, and we are not going to let like that we're going back. The former government, see, they were so much into development. What makes you happy? You have very beautiful buildings and you have no medical care. People are dying. There's no medicine even because as a result of very basic drugs which are affordable. So our dispensation is totally different. And when we are moving around, we assure the medics that we are going to support you and you support us. What we want is partnership. We never came here to intimidate anyone. You want to do, you do our work, we do our work, and we motivate you. There are people saying that some are not demotivated, some of you are demotivated because of the contractual arrangement that you have. People getting different kind of wages. We are going to work on that, but you do your part. The CS has talked about pilferage. Even though I could go between Novodogo hospitality, that one we are not going to control. Take that one to the bank. The other day when you were there, I said that if you are not going to move as our norms, as our nini, then afadhali kujitoa mapema, kwa sababu hakuna haja tunaikatawa hapa, inapita kwa fence, inarudi kwa kliniki za watu. That one we are not going to take. You take that to the bank. Personally, I've said that in fact I will supervise our sister excellency to supervise how the drugs are getting here, how they are getting to the level 4, level 3. Nitakuja huko mimi mwenyewe. ndio tuone kila kitu dawa iko safe na kila kitu iko sawa sawa. Okay, having said that, I think we are also going to work on systems to ensure that drugs in fact are safe. We need to digitalize hii mahali ikuwe sawa sawa. When we are moving around and went to the pharmacy, unaambiwa hii dawa ni ya sijui ni ya inpatient na hii ni outpatient. But how it gets there, inakuwa that's another story. So the loopholes are there. So gentlemen, we are really supporters because we mean well. We want to lead people who are healthy. Tunataka kujenga mabarabara na building kubwa sana kama watu wetu wanaendelea kufa. So support us in that one.